Here's a statistic that stopped me in my tracks this week. Dementia has officially overtaken heart disease as Australia's leading cause of death. After decades of heart disease holding the top spot, we've reached a genuine turning point in public health. And frankly, this changes everything about how we need to think about prevention. Let me give you the numbers because they tell an important story. In 2024, dementia accounted for over 17,500 deaths. That's 9.4% of all deaths in Australia. Heart disease, meanwhile, dropped to 8.7%. Now, before anyone panics, this isn't just bad news. It's actually a tale of two trends. Here's what's really happening. Deaths from dementia have risen by 39% over the last decade, while mortality from heart disease has plummeted by nearly 90% since it peaked in 1968. That dramatic drop in heart disease deaths, that's a massive public health victory. Better medications, better acute care, people taking statins, managing their blood pressure, quitting smoking, all of it worked. We fundamentally changed the trajectory of cardiovascular disease. But dementia, we haven't had the same success story yet. What I find particularly striking in this data is the gender difference. Dementia has been the leading cause of death for Australian women since 2016, and 62.4% of people who died from dementia in 2024 were women. Part of this is simply that women live longer. The median age of death from dementia is 88.7 years, so they're more likely to reach ages where dementia risk accelerates. But it's a reminder that brain health isn't gender neutral. Now here's where it gets really concerning. There are currently about 433,300 Australians living with dementia, and without significant intervention, that number is expected to exceed 1 million by 2065. Think about that. We could see the number of people living with dementia more than double in the next 4 decades. So here's what this means for you, regardless of your age. We can't treat dementia the way we treated heart disease in the 1970s, waiting until people are sick and then trying to fix it. The time to think about brain health is now, whether you're 30, 60, or 80. What we know from the research is that many of the same lifestyle factors that crushed heart disease rates also protect against dementia. Regular physical activity, and I mean regular, not just weekends, appears to be one of our strongest tools. Managing vascular risk factors, blood pressure, cholesterol, diabetes, social engagement, isolation is toxic for brain health, keeping mentally active and challenged, good sleep, which we now understand is when the brain does its cleanup work, literally washing out the protein debris that can accumulate into dementia pathology. In my years working with people struggling with addiction and lifestyle-related diseases, I've seen this pattern repeatedly. The choices we make in our 40s and 50s, sometimes even earlier, set the stage for our brain health in our 70s and 80s. Heavy alcohol use, poor sleep, chronic stress, social isolation, sedentary living, all of these chip away at cognitive reserve. Look, we don't have a cure for dementia yet. We don't have that magic pill equivalent of statins for the heart, but we do have evidence that lifestyle matters enormously, and unlike our predecessors who faced the heart disease epidemic, we have the data now to make different choices before the disease develops. The numbers from the ABS aren't just statistics, they're a wake-up call. Australia's aging successfully. People are living longer, and that means we all need to be thinking about protecting our brains with the same intensity we brought to protecting our hearts. Your future brain health, it's being shaped by what you do today.